Question 1. The primary purpose of the Office of Inspector General, OIG, work plan is to identify which of the following? A. Clinical documentation standards for physicians. B. New ICD-10 CM codes for annual updates. C. Areas of Medicare and Medicaid that are vulnerable to fraud, waste, and abuse. D. Billing requirements for private insurance carriers. Answer C. Areas of Medicare and Medicaid that are vulnerable to fraud, waste, and abuse. The concept being tested here is the regulatory function of the OIG work plan, which is an essential compliance document. The OIG work plan is an annual list of focus areas, and the keyword primary purpose directs attention to its core mission to address fraud, waste, and abuse within federal healthcare programs like Medicare and Medicaid. The OIG then investigates these listed areas to protect program integrity and taxpayer dollars. For example, a recent work plan might focus on improper billing for prolonged services or monitoring EHR security vulnerabilities. A good takeaway tip is that whenever you see the OIG mentioned, think federal law enforcement against fraud and protecting government program funds. Question 2. Which law prohibits a physician from referring Medicare or Medicaid patients to an entity in which the physician or an immediate family member has a financial interest? A. The Anti-kickback statute. B. The False Claims Act. C. The Stark Law. D. The Exclusion statute. Answer C. The Stark Law. This question tests knowledge of one of the major fraud and abuse laws, specifically the Stark Law. The key clue here is the specific mention of a physician's financial interest in an entity and the prohibition against referring patients to it. The Stark Law, also known as the Physician Self-Referral Law, is strict liability, meaning intent is not required to violate it. For instance, a physician cannot refer a Medicare patient for lab services to a lab where the physician has an ownership share. Remember, the Stark Law is focused only on physician referrals when a financial relationship exists, helping you differentiate it from the Anti-kickback statute. Question 3. What is the fundamental ethical principle that obligates a medical coder to ensure services rendered are supported by the documentation in the patient's health record? A. Patient confidentiality. B. Medical necessity. C. Record retention. D. Professional courtesy. Answer B. Medical necessity. This question focuses on the core concept of medical necessity, which underpins all compliant coding and billing. The keywords services rendered are supported by the documentation highlight that a procedure or service must be reasonable, necessary, and appropriate according to evidence-based clinical standards for the patient's condition. If the documentation shows a patient has a sprained ankle, it would not support a bill for an MRI of the knee, proving that the service lacked medical necessity. Always remember that for a code to be billable, it must not only be documented but also be medically necessary for the patient's diagnosis. Question 4. Under HIPAA, what is the term for the process of safeguarding and protecting electronic protected health information, EPHI, from unauthorized access, use, or disclosure? A. Administrative simplification. B. Privacy rule. C. Security rule. D. Transaction rule. Answer C. Security rule. This item tests the differences between the core components of the Health Insurance Portability and Accountability Act, HIPAA, specifically the security rule. The keyword clues are safeguarding and protecting electronic protected health information, EPHI. The HIPAA security rule mandates specific administrative, physical, and technical safeguards that covered entities must implement to ensure the confidentiality, integrity, and availability of EPHI. For example, ensuring that electronic health records require a password and are encrypted is a technical safeguard under this rule. Here's an easy way to remember. The privacy rule covers who can access PHI, while the security rule covers how PHI is protected. Question 5. The minimum necessary standard under the HIPAA privacy rule requires a covered entity to do which of the following? A. Limit the use and disclosure of PHI to the least amount required to accomplish the intended purpose. B. Only share PHI with the patient's family members, regardless of their role in care. C. Retain patient records for a minimum of 10 years after the last date of service. D. Implement a mandatory electronic health record (HR) system for all PHI. Answer A. Limit the use and disclosure of PHI to the least amount required to accomplish the intended purpose. This question evaluates understanding of the HIPAA privacy rules minimum necessary standard, with the keyword minimum necessary being the direct clue. This standard is a critical regulatory requirement designed to protect patient privacy by ensuring that when PHI is used or disclosed, only the absolute necessary information is shared to complete a specific task. For example, a billing clerk needs access to a diagnosis and CPT codes for claim submission, but they do not need access to the patient's full mental health history. The key takeaway is to always share the minimum amount of protected health information required for the task, whether that is for payment, treatment, or operations. Question 6. The False Claims Act, FCAE, is a federal law primarily intended to prosecute individuals or companies that commit which of the following acts? A. Failure to use required ICD-10 CM codes. B. Retaliation against whistleblowers. C. Submission of knowingly false or fraudulent claims to the government. D. Breach of confidentiality of electronic health records. Answer C. Submission of knowingly false or fraudulent claims to the government. This tests knowledge of the False Claims Act, a key piece of anti-fraud legislation. The keywords False Claims Act and knowingly false or fraudulent claims are directly related, establishing the core concept. The FCA imposes significant penalties for submitting claims to federal programs like Medicare or Medicaid that the submitter knows, or should know, are false. A common example is upcoding, where a provider bills for a higher-level service than was actually provided, thereby defrauding the government. Remember, the FCA is a civil or criminal statute that focuses on false claims made to the government, often including the CATAM provision that allows whistleblowers to file suit on the government's behalf. Question 7. A coder submits claims to Medicare for services that were not medically necessary. The coder knew these services were not needed but billed them anyway to maximize reimbursement. This scenario is a clear example of A. Abuse. B. Waste. C. Fraud. D. Unbundling. Answer C. Fraud. This question tests the fundamental distinction between fraud and abuse in the context of compliance. The critical keyword is new, indicating a deliberate and intentional act of deception. Fraud involves intentional misrepresentation to receive payment, such as billing for services never rendered or, in this case, billing for services the coder knew were not medically necessary. Abuse, by contrast, involves improper or excessive actions that result in unnecessary costs, but without malicious intent. The simple takeaway is that intent separates fraud from abuse. If intent is present, it is fraud. Question 8. What is the standard number of elements recommended by the OIG for a healthcare compliance program? A. 3. B. 5. C. 7. D. 10. Answer C. 7. This item tests a fundamental piece of compliance knowledge, the established structure of an effective compliance plan. The keyword is OIG, which refers to the federal office that publishes guidance on compliance best practices, recommending a specific structure. The OIG recommends 7 distinct elements that organizations should implement to prevent and detect fraud, waste, and abuse. These elements include things like conducting internal monitoring, establishing standards of conduct, and implementing disciplinary guidelines. Always remember the magic number 7 when you are asked about the OIG's recommended compliance elements. Question 9. Before rendering a service to a Medicare beneficiary that the provider believes may be denied for lack of medical necessity, the provider should obtain which document? A. Advance directive. B. Prior authorization. C. Advance beneficiary notice of non-coverage, ABN. D. Hospital discharge summary. Answer C. Advance beneficiary notice of non-coverage, ABN. The concept tested is the proper procedure for billing non-covered services to Medicare patients. The key clue is the patient being a Medicare beneficiary and the service being potentially denied for lack of medical necessity. The ABN, Form CMS R131, is a mandatory written notice provided to a Medicare beneficiary before services are rendered when the provider believes Medicare will not pay. This ensures the patient is fully aware that they may be financially responsible for the charges. A good way to remember this is that the ABN is the form that protects the provider's right to bill the patient and protects the patient's right to appeal the Medicare denial. Question 10. Which HIPAA transaction standard governs the electronic submission of claims from a provider to a payer? A. ASC X-12-837. B. ASC X-12-270. C. ASC X-12-271. D. ASC X-12-835. Answer: A. ASC X-12-837. This question tests foundational knowledge of HIPAA's administrative simplification standards, specifically the required electronic data interchange (EDI) format for claims. The clue is the phrase, electronic submission of claims from a provider to a payer. The ASC X-12-837 is the required standard for electronic healthcare claim submission. Conversely, the 835 is the electronic remittance advice array used by the payer to send payment and denial details back to the provider. The key takeaway is to associate the 837 with the submission of the claim and the 835 with the payment/explanation of benefits back from the payer. Question 11. Which organization has the responsibility for issuing national coverage determinations, NCDs, regarding whether specific services are covered under Medicare? A. American Medical Association, AMA. B. Centers for Medicare and Medicaid Services, CMS. C. Office of Inspector General, OIG. D. World Health Organization, WHO. Answer: B. Centers for Medicare and Medicaid Services, CMS. This question focuses on identifying the governmental body responsible for federal payment policies, specifically National Coverage Determinations, NCDs. The NCDs are national policies, and the organization in charge is the Centers for Medicare and Medicaid Services, CMS, which administers the Medicare program. The keyword National Coverage Determinations tells you the policy is nationwide, ruling out local entities like MECs. If a local contractor needs to determine coverage, they issue a local coverage determination LD, but the overall national policy comes from CMS. Question 12. If a provider is found to be non-compliant with federal healthcare program requirements, the OIG may impose sanctions, which include: A. Requiring the provider to obtain a new medical license. B. Exclusion from participation in all federal healthcare programs. C. Mandatory use of a specific electronic health record system. D. A permanent waiver of all patient financial responsibility. Answer: B. Exclusion from participation in all federal healthcare programs. This question explores the severe consequences of non-compliance, particularly the type of sanctions imposed by the Office of Inspector General, OIG. The OIG maintains a list of excluded individuals and entities, and one of the most serious sanctions is exclusion from all federal healthcare programs, including Medicare and Medicaid. This exclusion means that no federal program payment can be made for services furnished by that person or entity. The purpose of exclusion is to protect federal programs and patients from fraudulent or unfit providers. Remember that exclusion is a very powerful deterrent, essentially taking away a provider's ability to treat Medicare/Medicaid patients. Question 13. What is the common term for reporting two or more CPT codes for services that are routinely included in a single CPT code, resulting in increased payment? A. Upcoding. B. Unbundling. C. Clustering. D. Downcoding. Answer: B. Unbundling. This question tests the concept of unbundling, a form of improper billing and a serious compliance risk. The keyword clue is reporting two or more CPT codes for services that are routinely included in a single CPT code. Unbundling is essentially separating procedures that should be billed together as a single service to increase reimbursement. For example, billing separately for a surgical procedure and the associated local anesthesia when the anesthesia is a standard component of the main procedure is considered unbundling. The key distinction is that unbundling involves separating codes, while upcoding involves choosing a higher-level code. Question 14. Which document must be completed by a hospital if a patient is discharged and a delay in care could result in a serious medical condition or injury? A. Local Coverage Determination, LD. B. Advanced Beneficiary Notice, ABN. C. Detailed Notice of Discharge, DND. D. Hospital-Issued Notice of Non-Coverage, N. Answer D. Hospital-Issued Notice of Non-Coverage, HIN. This question tests knowledge of specific regulatory notices required in the hospital setting. The clue is the patient being in a hospital and the notice relating to a potential denial of coverage for an inpatient service, often related to discharge decisions. The Hospital-Issued Notice of Non-Coverage, HIN, is the official CMS document hospitals use to notify Medicare beneficiaries when the hospital expects Medicare may deny payment for some or all of the patient's inpatient care. The ABN, by comparison, is generally used in non-inpatient settings. Always distinguish the ABN as a general notice and the HIN as the specific notice used in the hospital inpatient setting. Question 15. The Health Information Technology for Economic and Clinical Health, HITECH, Act primarily strengthened HIPAA by A. Eliminating the need for the Stark Law. B. Mandating the use of ICD-10 CM coding. C. Increasing the penalties for non-compliance and expanding the scope of the security and privacy rules. D. Requiring all health plans to offer free preventative care services. Answer C. Increasing the penalties for non-compliance and expanding the scope of the security and privacy rules. This question focuses on the regulatory changes brought about by the HITECH Act, an important law related to health information technology. The keyword HITECH should trigger recognition of its core goal, which was to promote the adoption of electronic health records while significantly strengthening the enforcement of HIPAA. HITECH accomplished this by increasing the monetary penalties for violations and extending the direct applicability of the HIPAA rules to business associates. Therefore, HITECH made HIPAA enforcement much more consequential and financially punitive. Question 16. What is the central difference between a covered entity CE and a business associate, BA, under HIPAA? A. A BA must be an employee, while a CE must be an independent contractor. B. A CE conducts the primary healthcare treatment, while a BA performs functions on the CE's behalf that involve the use of PHI. C. A BA is directly liable for HIPAA violations, while a CE is not. D. A CE must retain records for 5 years, while a BA must retain records for 10 years. Answer B. A CE conducts the primary healthcare treatment, while a BA performs functions on the CE's behalf that involve the use of PHI. This question is testing the foundational HIPAA compliance concept of identifying who is obligated to follow the rules. The keyword central difference asks for the primary distinction between the two entities. A covered entity CE is a provider, health plan, or clearinghouse, whereas a business associate, BA, is a person or entity that performs services for the CE and, in doing so, handles protected health information, PHI, like a billing service or external IT company. The BA must sign a business associate agreement, A, to ensure they comply with HIPAA rules. The simple takeaway is that the CE is the healthcare provider or payer, and the BA is the company working on the CE's behalf that touches PHI. Question 17. The process of intentionally reporting a service or procedure with a higher code than was actually performed to receive a higher reimbursement is known as A. Upcoding. B. Unbundling. C. Clustering. D. Downcoding. Answer A. Upcoding. This question tests the definition of upcoding, which is a major compliance risk and a form of fraud. The keywords intentionally reporting a service with a higher code clearly define upcoding. This deceptive practice results in the payer reimbursing a higher amount than is appropriate for the service actually rendered, such as billing an established patient level for E/M code when the documentation only supports a level 2. Upcoding is taken seriously because it is an intentional misrepresentation to defraud the payer. Remember that upcoding is the opposite of downcoding. It is always choosing a code that yields a higher payment. Question 18. What is the purpose of a business associate agreement, BA, under HIPAA? A. To establish the rates a vendor can charge for its services. B. To document that the business associate will comply with HIPAA rules regarding the use and disclosure of PGI. C. To waive the business associate's liability in the event of a data breach. D. To require the business associate to become a covered entity. Answer B. To document that the business associate will comply with HIPAA rules regarding the use and disclosure of PGI. This question assesses understanding of the required agreement between a covered entity and its vendor, the business associate agreement, BA. The keyword purpose points to the fundamental reason for the agreement, which is to ensure the BA protects the protected health information, PGI, it handles in the same manner as the covered entity. The BAA is a regulatory necessity that legally binds the BA to adhere to the HIPAA security and privacy rules. Simply put, the BAA is the contract that makes the business associate directly responsible for protecting patient privacy. Question 19. A key element of a successful compliance plan is auditing and monitoring. What is the main goal of this element? A. To calculate the organization's annual profit margin. B. To verify that billing, coding, and documentation practices are accurate and compliant. C. To determine which employees will receive bonuses. D. To compare the organization's CPT codes with national averages. Answer B. To verify that billing, coding, and documentation practices are accurate and compliant. This question focuses on one of the 7 elements of an OIG recommended compliance plan. The element is auditing and monitoring, and its main goal is to proactively review the organization's practices to prevent noncompliance. Auditing typically involves checking coded claims against the supporting medical documentation to ensure the codes selected are accurate and compliant with payer rules and federal regulations. A practical example is a periodic internal audit of E/M services to check for proper use of time or medical decision-making. Always remember that auditing and monitoring is the proactive measure to find and fix problems before an external payer or government agency does. Question 20. When is it permissible for a provider to bill a Medicare patient for an office visit or service that was provided by a non-physician practitioner, NPP, as if the physician personally performed it? A. When the NPP is a physician's family member. B. When the service meets the criteria for incident to billing. C. When the patient specifically requests the physician's name on the claim. D. Never. All NPP services must be billed under the NPP's NPI. Answer B. When the service meets the criteria for incident to billing. This question tests a key regulatory concept in professional fee billing, which is the Medicare incident to rule. The clue is the phrase bill, as if the physician personally performed it for a service done by a non-physician practitioner, NPP. The incident to rule allows services provided by an NPP to be billed under the Supervising Physician's National Provider Identifier, NPI, at 100% of the physician fee schedule, provided all criteria, like direct supervision in the office setting, are met. If the NPP is seeing a new patient or an established patient with a new problem, the incident to rule does not apply, and the service must be billed under the NPP's NPI. Question 21. Which regulation is designed to ensure that all patients seeking emergency care are given a medical screening exam and stabilization, regardless of their ability to pay? A. Anti-kickback statute, AKS. B. Emergency Medical Treatment and Active Labor Act, EMTALA. C. HITECH Act. D. Stark Law. Answer B. Emergency Medical Treatment and Active Labor Act, EMTALA. This question tests knowledge of the specific federal regulation governing emergency department procedures. The keywords emergency care, medical screening exam, and regardless of their ability to pay clearly identify the Emergency Medical Treatment and Active Labor Act, EMTALA. EMTALA prevents hospitals with emergency departments from turning away patients or delaying their care based on insurance status or financial standing. For example, a hospital cannot ask an emergency patient for proof of insurance before a screening is performed. Remember that EMTALA focuses on access to care in the emergency setting. Question 22. which law makes it a crime to knowingly offer, pay, solicit, or receive any remuneration to induce or reward referrals for items or services reimbursable by a federal healthcare program. A. Anti-kickback statute, AKS. B. Stark Law. C. False Claims Act, FC. D. HIPAA Privacy Rule. Answer: A. Anti-kickback statute, AKS. This question tests the specifics of the anti-kickback statute, AKS, another major fraud and abuse law. The keyword clues are the phrase offer, pay, solicit, or receive any remuneration to induce or reward referrals. The AKS is a criminal statute that prohibits the exchange of anything of value to encourage the referral of federal healthcare program business. Unlike the Stark Law, which only involves referrals and financial relationships, the AKS is broader and concerns any form of compensation or kickback given in exchange for referrals. Think of the AKS as the rule against buying or selling referrals for government-paid services. Question 23. What is the primary purpose of the Clinical Laboratory Improvement Amendments, CLIA? A. To set standards for electronic health record (HR) documentation. B. To ensure the accuracy, reliability, and timeliness of patient test results. C. To regulate the privacy of patient test results under HIPAA. D. To determine coverage and payment for laboratory services under Medicare. Answer: B. To ensure the accuracy, reliability, and timeliness of patient test results. This question tests the regulatory purpose of the Clinical Laboratory Improvement Amendments, CLIA. The keyword clinical laboratory is the direct clue connecting the law to the quality of testing. CLIA establishes quality standards for all laboratory testing performed on human specimens in the U.S. to ensure the accuracy and reliability of test results. For example, a physician's office performing simple urinalysis must obtain a CLIA waiver to ensure minimal standards are met. The key takeaway is that CLIA is about regulating quality and accuracy in laboratory testing, not payment or privacy. Question 24. A key component of a compliance plan is the designation of a compliance officer. What is the primary responsibility of this role? A. To write all medical necessity policies for the organization. B. To monitor and manage the day-to-day operations of the compliance program. C. To sign all Medicare claims before submission. D. To personally perform all internal audits and investigations. Answer: B. To monitor and manage the day-to-day operations of the compliance program. This question focuses on a foundational requirement of the OIG's 7-element compliance plan. The compliance officer is the key clue, whose primary role is to lead and manage the program. The compliance officer serves as the focal point for compliance activities, overseeing the development, implementation, and continuous monitoring of the organization's compliance plan. This ensures that the program is functional and responds to potential risk areas. The compliance officer is the designated leader responsible for creating a culture of compliance within the organization. Question 25. Which one of the following is an example of an unacceptable use of protected health information, PHI, without patient authorization? A. Disclosure of PHI to another provider for the purpose of patient treatment. B. Use of PHI for routine quality improvement activities within the facility. C. Selling a patient list containing PHI to a pharmaceutical company. D. Disclosure of PHI to a government agency for a public health activity. Answer: C. Selling a patient list containing PHI to a pharmaceutical company. This question tests knowledge of allowable uses and disclosures of protected health information, PHI, under HIPAA, with the keyword unacceptable use. HIPAA generally permits the use of PHI without authorization for treatment, payment, and healthcare operations, TPO. However, selling a patient list for marketing purposes is a highly restricted, unacceptable disclosure that generally requires explicit patient authorization. The distinction is that TPO uses are essential to running the business of healthcare, while selling patient data is a commercial activity that directly violates the intent of the privacy rule. Question 26. Under the False Claims Act, FCA, What is the term for the provision that allows a private citizen to bring a lawsuit on behalf of the government against a person or company who has defrauded the government? A. Remittance advice. B. CATM. C. Respondeat superior. D. Fee-for-service. Answer B. CATM. This question assesses knowledge of the enforcement mechanism of the False Claims Act, FCA. The keywords private citizen to bring a lawsuit on behalf of the government directly describe the CATM provision. This provision encourages whistleblowers to report fraud against federal programs by allowing them to file a suit and potentially receive a percentage of the recovered funds. This provision is a powerful tool for the government to uncover fraud that otherwise might go undetected. Always connect the CATM provision with the False Claims Act and the concept of whistleblowing. Question 27. The legal concept that holds an employer responsible for the actions of its employees is known as A. Stare decisis. B. Residential ipsa loquitur. C. Respondeat superior. D. Corpus juris. Answer C. Respondeat superior. This question tests a foundational legal principle that is crucial in compliance risk management, especially regarding billing errors. The phrase holds an employer responsible for the actions of its employees is the direct definition of the common law doctrine of respondeat superior. This means that the physician or organization can be held legally liable for the fraudulent or negligent actions of their billing staff or coders. For instance, if a billing employee knowingly upcodes services, the physician or practice is still legally accountable for the resulting false claim. The key takeaway is that the organization must monitor its employees' actions because the law holds the employer responsible for their staff. Question 28. What is the general Medicare requirement for how long provider documentation, medical records, must be retained? A. 3 years. B. 5 years. C. 6 years. D. 10 years. Answer C. 6 years. This question tests a common regulatory requirement for record retention, a key component of compliance. While many states have different requirements, the general Medicare requirement is often cited as a key minimum for compliance. Medicare regulations require medical records to be maintained for a minimum of 6 years from the date of the creation or the time it was last in effect, which is the most critical benchmark for federal program compliance. Additionally, HIPAA requires retention of its compliance-related documentation for 6 years. The simplest advice is that to meet federal standards, a minimum of 6 years is the standard you should remember. Question 29. If a Medicare Part B claim is submitted more than 12 months after the date of service, it will generally be A. Approved and paid at 100% of the allowed amount. B. Approved but paid at 50% of the allowed amount. C. Denied because it exceeds the timely filing limit. D. Held for review by the OIG for potential fraud. Answer C. Denied because it exceeds the timely filing limit. This question tests a fundamental compliance and billing rule regarding timely filing. The clue is the claim being submitted more than 12 months after the date of service. Medicare Part B has a strict timely filing deadline, which is 1 calendar year, 12 months, from the date of service. If a claim is submitted past this deadline, it is typically denied and cannot be appealed, making timely submission a vital compliance and financial risk area. This rule demonstrates the necessity of prompt and accurate claim submission in the billing process. Question 30. Which document is used by a provider to notify a patient that a service is not covered by their commercial, non-Medicare insurance plan? A. Advance Beneficiary Notice, ABN. B. Notice of Exclusion from Medicare Benefits, NEMB. C. Commercial Payer Waiver. D. Hospital-Issued Notice of Non-Coverage, N. Answer C. Commercial Payer Waiver. This question highlights the difference between Medicare compliance forms and commercial insurance forms. The key clue is that the insurance plan is commercial, non-Medicare. The Advanced Beneficiary Notice, ABN, is strictly for Medicare. When dealing with private or commercial payers, the provider uses a generic waiver or authorization form, often referred to as a commercial payer waiver or sometimes a notice of excluded services. This waiver serves the same function as the ABN, to document that the patient was informed and accepted financial responsibility before the service. Remember, if the payer is not Medicare, the ABN cannot be used. Question 31. When performing internal audits of medical necessity, what should a coder use to verify if a procedure or service is covered for a specific diagnosis? A. The AMA Code of Ethics. B. The CMS National and Local Coverage Determinations, NCDs/LCDs. C. The OIG List of Excluded Individuals and Entities. D. The hospital's chargemaster. Answer B. The CMS National and Local Coverage Determinations, NCDs/LCDs. This question addresses the necessary resources for compliant medical necessity checking. The keywords internal audits and verify if a procedure or service is covered for a specific diagnosis point directly to coverage rules. The Centers for Medicare and Medicaid Services, CMS, issues National Coverage Determinations, NCDs, and its contractors issue Local Coverage Determinations, LCDs, which provide detailed, evidence-based rules defining when a specific service is considered medically necessary and eligible for payment. For example, an LCD might state that a certain lab test is covered only for patients with a specific range of diagnoses. Always consult the NCDs and LCDs to ensure your documentation and coding meet the payer's necessity requirements. Question 32. Which of the following defines a system or procedure that prevents and detects improper billing practices resulting from ignorance, carelessness, or mistakes? A. Fraud. B. Abuse. C. Waste. D. Compliance program. Answer D. Compliance program. This question tests the overarching concept of a compliance program, which is the system designed to avoid improper billing. The keywords are system or procedure that prevents and detects improper billing practices resulting from ignorance, carelessness, or mistakes. A formal compliance program, with its 7 elements, is the internal structure put in place to ensure all organizational operations adhere to legal and ethical standards, thereby catching errors, abuse, and intentional deception, fraude. A key function of the compliance program is to train staff and put in place internal audits that proactively address potential issues. Question 33. Under HIPAA, what type of organization is a health plan, a healthcare clearinghouse, or a healthcare provider who transmits health information in electronic form? A. Business associate. B. Covered entity. C. Sanctioned entity. D. Third-party administrator. Answer B. Covered entity. This question tests the foundational definition of a covered entity C under the HIPAA regulations. The list provided: health plan, a healthcare clearinghouse, or a healthcare provider who transmits health information in electronic form is the exact regulatory definition. These entities are directly responsible for complying with the HIPAA privacy and security rules because they are the primary handlers of patient information. For example, a doctor's office that bills electronically is a covered entity. The key takeaway is to recognize the 3 types of organizations that HIPAA holds primarily accountable: plans, clearinghouses, and providers. Question 34. According to the OIG, one crucial element of an effective compliance plan is taking disciplinary action. This element is designed to address which issue? A. Noncompliance with state labor laws. B. Failure to meet clinical quality benchmarks. C. Violations of the organization's compliance standards and policies. D. Insufficient revenue generation. Answer C. Violations of the organization's compliance standards and policies. This question focuses on the enforcement and disciplinary action element of the 7-element compliance plan. The element is designed to send a clear message that noncompliance will not be tolerated. This includes taking prompt and appropriate disciplinary action, such as warnings, demotions, or termination, against employees who violate internal compliance standards or federal laws. For example, a coder who repeatedly submits unbundled claims after receiving compliance training should face disciplinary action. Remember that without clear disciplinary guidelines, a compliance program has no teeth, and employees may ignore the rules. Question 35. The purpose of a recovery audit contractor, RACI, is to A. Conduct patient satisfaction surveys. B. Audit claims on a post-payment basis to identify and recover improper payments made by Medicare. C. Set the annual conversion factor for the Medicare physician fee schedule. D. Investigate potential criminal fraud cases for the Department of Justice. Answer B. Audit claims on a post-payment basis to identify and recover improper payments made by Medicare. This question tests the regulatory function of one of the key auditing bodies in the federal healthcare system, the Recovery Audit Contractor, RACI. The keywords Recovery Audit Contractor and improper payments are directly linked to the program's core mission. RACs review Medicare claims that have already been paid to identify and recover overpayments and occasionally underpayments due to documentation, medical necessity, or coding errors. For example, RAC may audit a facility for a pattern of incorrectly using a specific CPT modifier. The essential tip here is to remember that RACs perform post-payment audits with the goal of recovering money for the government.